Hello, everyone. Good morning, good afternoon, good evening. My name is Anushka Patel, and on behalf of the George Institute for Global Health, I'd like to warmly welcome you to the Building Back Better After COVID-19, the research agenda. I'm hosting this event from my home in Sydney, Australia, and I'd like to take a moment to acknowledge the traditional owners of this land, the Gadigal people of the Eora Nation, and pay my respects to elders past, present, and emerging. So absolutely delighted to have so many people attend from all around the world today. We have an absolutely fantastic panel, and we are, in addition to the panel, of course, very keen for everyone participating to be involved. And you can do this in a number of ways. We'll be having some Zoom polls during the session, so please vote in those. You can also post questions and comments in the Q&A box. Please use the Q&A box rather than the chat box. And of course, please do tweet using the hashtags displayed on the screen here. So Building Back Better COVID-19 and Act on NCDs. This event is being recorded and we will share that recording online subsequently. But before we start the discussion, we'd really like to kick off the event by taking the opportunity to premiere a video to set the scene and highlight some of the issues that we'll be discussing shortly. So sit back, enjoy. I'll hand over, Michael, if you could start the video, and look forward to reconnecting shortly.
The pandemic found a very poorly funded and ailing healthcare system with a very lean workforce. Now, the almost total focus on COVID-19 in the initial stages of the response led to the neglect of regular health services. So clinics did not run, outreach services stopped, immunizations were skipped, and in many instances, hospitals were suspending some services in order to make room for the COVID-19 units.
The COVID pandemic, the way I presented it, has exposed so vividly and so rapidly so many of the deficiencies that we carry in our health systems, and particularly how overburdening our healthcare workers.
In a recent survey from WHO, we could see that more or less 50% of the services were disrupted for people living with non-communicable diseases. As the pandemic progressed, of course, we could see that there was a progressing extent of disruption, and in the most affected areas with community-based pandemic, we could see up to between 50 and 60% of the services disrupted.
In the community level, we found that regular NCD screening program had been stopped almost 3 months. As a result, many high-risk individuals, who mostly older people and women, were unable to get their essential medications.
From the onset of the COVID-19, people living with non-communicable diseases, meaning diabetes, cardiovascular diseases, lung and heart diseases, are much more vulnerable to becoming severely ill and also dying from COVID-19.
The COVID-19 fatality rates in young adults in Mexico and Latin America are much higher than those observed in other areas such as Europe. This is the result of the high prevalences of obesity and non-communicable diseases in young adults in Latin America.
Coronavirus intersects with another really important global public health issue, which is obesity. It's rising all over the world, and it's an important concern in and of itself. And now it's an even more important concern because it's been shown to increase the risk of complications from the coronavirus.
The COVID-19 pandemic has had a colossal impact on the economy of the region and the country, exposing the most vulnerable risk group to a situation of insecurity and inequity. This impact has exposed the social difference there is regarding access to adequate food and housing and other basic needs. People in a situation of vulnerability also represent a large percentage of risk groups with worse health prognosis in case of illness from COVID-19.
Stress is a key factor in exacerbating NCDs, is well known, and chronic poverty is a major stressor. Already in India, data tells us that in urban areas, the lower quintiles are the ones who have higher prevalence of hypertension and diabetes particularly. And therefore, it will be this group that will take much longer to recover from the impact of the pandemic.
I think that we're seeing the widening of existing health inequalities, as well as the intersection of social and cultural determinants of health with COVID-19. So this includes things like economic disadvantage, issues with housing and people's physical environment, access to food and water, stable employment, and then also cultural determinants such as the disruption to people's connections with their community or traditional practices, or even access to healthcare that's free from racism. And with these exacerbated inequalities, we're seeing that it's often Indigenous peoples worldwide that are most affected during this public health emergency.
Until COVID-19 came along, the international community, for example, rarely was speaking about NCDs, about multimorbidity, about aging within the context of pandemic preparedness, within the context of health security, as well as health emergencies. That must all change going forward. The crisis should really be seen as an accelerator to help break down these very established silos within global health.
We have an opportunity. And the opportunity really is the recognition that public health is important, that the money spent on prevention and the effort put into prevention really works.
There is a major gap in the evidence, in research and in policy responses to multimorbidity, which COVID-19 has brought to the fore as a real priority for global health. The exact extent of the problem and the rate at which it's growing is still really poorly understood worldwide.
Because of travel and physical distancing restrictions, many activities that were carried out by healthcare workers face-to-face are currently being delivered using telephone or other media solutions. And I think it's probably there's a strong need to determine just how effective this is. Also, for those who are living with chronic conditions, where there's a need for regular and ongoing access to medication, we need the evidence around alternative solutions where people just can't get to clinics or pharmacies to obtain their medication.
Research focusing to find innovative ways for ensuring most vulnerable people to access essential health services. For example, research to develop an innovative telemedicine to replace in-person medical consultations will be benefit for vulnerable people in rural areas.
I believe research needs to ensure rapid community engagement assessment to collect data from it and allow better targeted actions and activities for vulnerable populations such as NCD social collectives.
Public engagement helps to build trust. It also widens the ambit of accountability. Public communication and public advocacy in a language and form that people of different sections of society can understand is important across countries, certainly very important in a country like India where there are huge information asymmetries.
We need to conduct more research that considers things through an equity lens and considers the social and cultural determinants on people's ability to access healthcare and to really live a healthy life. We need more research that recognises the strength and resilience of communities that are often underserved or undervalued.
As we see, the pandemic is exacerbating them through disrupting food consumption, level of physical activity, and also level of their mental health.
Preventing the development of the likelihood of chronic conditions in the first place would be a great step in resilience. But looking more pragmatically at resilience, we need a spectrum of research that's both biomedical, social, cultural, behavioral, to understand how to support those who are actively trying to manage their own health and well-being through physical exercise, through their diet, through reducing their alcohol intake. And we need evidence on how to maintain positive mental health.
The coronavirus raises a really important challenge for the world today, a really important question. How can the world develop and sustain an economy that supports people's livelihoods and that provides the goods and services that we need while also supporting their health?
We need to have answers to what kind of lockdowns are not just effective in stopping the virus, but also in allowing people to survive. Were we to have another lockdown, what shape, what form should it take?
There are many issues that come to attention. For example, crowding and overcrowding in big cities and transport, which calls for how we plan our cities better and how we organize our cities better. Food supplies, food systems, how do we depend on multiple layers of connections for having a healthy behavior and lifestyle.
We're also seeing emerging evidence on COVID and on previous similar diseases that shows that there's a range of social and demographic factors at play, and that's age, race, ethnicity, class, that are intersecting with gender to explain the differential risk of disease and death due to COVID. And understanding how these factors interact is really essential to then better targeting research and tailoring public health approaches.
There was perhaps never a time when doing research was actually more challenging, but actually doing research is incredibly important to provide us with that much needed evidence on how we will tackle the next pandemic more effectively and more quickly.
I am really hopeful that the coronavirus pandemic, as awful as it has been, will have some silver linings. And one of those is that non-communicable diseases will be taken more seriously by the global community. And that will mean we're more likely to achieve target 3.4 of the Sustainable Development Goals.
I hope you've enjoyed that video. Many thanks to everyone who contributed, some of whom are panelists today. If you weren't able to view that video effectively, that's going to be available very shortly on our website. So to discuss the many important issues and others that were raised in the video, we do have a great panel of speakers today, and I'll introduce each panel member briefly so that we can maximize the time available for discussion. So I'd really like to extend a welcome to Jean Buckman, who's the Director of NCD Synergies at Partners in Health, Assistant Professor at Harvard Medical School and Co-Chair of the Lancet NCD Poverty Commission. Hello, Jean. Katie Dane, the CEO of the NCD Alliance. Olive Kobusinge, a Senior Research Fellow at the Makerere School of Public Health in Kampala, Uganda. Bente Mikkelsen, Director of NCDs at the World Health Organization. Juan Rivera, Director General of the National Institute of Public Health in Mexico and also Professor of Nutrition at the Mexican School of Public Health. And last but not least, Rajni Ved, Executive Director of the National Health Systems Resource Center in New Delhi in India. So absolutely delighted to have you all with us and really looking forward to your thoughts. Before we start, I'd like to give the audience participants the chance to respond to one of the questions I'll be asking our panel in a moment through the Zoom poll we're running. So that poll should be now visible to everyone. You can respond to the poll, and the question is, are you concerned or optimistic about the place of NCDs on the global research agenda in light of the COVID-19 pandemic? We look forward to your responses. We'll have a look at the summary of the responses a little bit later on in the discussion. And of course, please, as I mentioned earlier, share your questions and your comments through the Q&A box, and we'll try and get to as many of these as possible during the discussion. So first, if I can now turn to the panel and ask each of you to address two questions. The first is the one that we've just put forward in the poll. Are you concerned or optimistic about the place of NCDs on the global research agenda in the current climate? And secondly, considering the many intersections between COVID-19 and NCDs, and some of which were touched on in that video, where would you specifically prioritize research, and what are your reasons for that? Perhaps we can start with Bente Mikkelsen. WHO clearly has a major role to play across all these issues, and I look forward to your comments.
Thank you very much, and thank you also for organizing this. It's a really due time and very timely. So, of course, no need to say that NCD remain one of the biggest socioeconomic development problems, and COVID-19 has, as you've shown in the video as well, really been about sort of the deadly interplay between a very sort of silent epidemic and, of course, a very loud pandemic. So your question is also a very good one, and I think you should maybe give me the last slide if you don't mind, because your first question was about if we are really sort of optimistic about the place NCD on the global research agenda in light of the pandemic, isn't that so? So actually, I must say that I am not so optimistic. I think if we don't act now, we will not have many more chances. So hopefully there will be a push. But if I look back to the first Global Research and Innovation Forum happening this year, and also the second one, we could see that NCD was not really flagged among the research questions. That said, of course, if I look at the 163 countries coming back with their asks to WHO, there is a lot of awareness about the research need that exists. So they had questions both about the guidance that community needs on digital health, how to really operational existing research and implementation research and learn from this pandemic. They had also questions that was in the interface between communication, risk communication, and research, and a lot of requests on better data, both sort of how to collate and how to utilize the data, but a lot of data that is really linked to the main questions that I will come back to with the next question. And of the country support, because even if we think that we have a lot of guidance for countries, if we look at the scale of, there is still a lot of requests. So I think what I'm saying is that maybe when we meet as researchers in the more traditional research settings, we don't really get these prioritizations. If we meet with NCD researchers, we have done that in 2011 under the leadership of Al-Alwan, and again in 2016. Of course, we get the prioritized research agenda. I think we need to look at this again, and I think this is a golden opportunity. So that is the answer to your first question. Thank you.
Thank you. So I will now ask Jean Buckman. Jean, I know you have many interests that extend beyond the 5x5 agenda, so very interested in your comments.
Yeah, I mean, it's interesting. So in terms of my research background, I'm a medical anthropologist, so I tend to kind of look at these things a bit, from the clouds sometimes. And one of the things I'm sort of wondering about, in terms of the research agenda, to Benti's point about, there's a way in which I think there's a question about existing categories and how are they, what categories are going to be important going forward? Are we going to see a reconfiguration of categories around which people are mobilizing post-COVID? I think that one of the striking things that you see is this emergence of sort of this concept of underlying conditions that are spoken of instead of NCDs, right? Like even in the settings where there's been an experience of COVID, and predominantly these are non-communicable diseases, there's been a reluctance to talk about them as such. And I think that's sort of an interesting comment on the limitations of NCD as a category, something to think about. And there may be this sort of notion of kind of endemicity and epidemicity, underlying conditions versus kind of emergent epidemic conditions and their interaction that's important. So that's kind of something to think about. I think that we also sort of see this transformation within the NCD category with the last UN high-level meeting, the introduction of mental health and household air pollution that kind of fractures the logic, I think, of the this kind of configuration of diseases that have delimited what NCDs are over the past decade. And as you've mentioned, there are many ICD codes that are included within NCDs, many musculoskeletal conditions, congenital conditions, et cetera, that point to a more complex health response. So I wonder how within our research agendas we're going to respond to that. So I guess that's sort of a question if we're sort of seeing limitations of the NCD category. Are there sort of subsets of diseases that become more meaningful? Are there new categories that we're going to be proposing research agendas around? It's something to consider. The other thing from a bird's eye view that I'd be interested in, and this sort of is responding to some of the questions on the chat about how do we influence funding. I mean, I think that we do have to reflect on the abysmal failure in the last decade of global solidarity around NCDs in a time of enormous global economic growth and expansion, and how disgraceful it is really that following the UN high-level meeting, there's really been no increase in commitments, concrete commitments by governments to support the poorest countries and the poorest people with their NCD burden. And I think that there's a need for a research agenda that's focused on that question, about how why that's happened. Are there other ways of mobilizing global solidarity? Are there other ways of mobilizing funding in the interest of that? I mean, I think that we've seen a failure of state politics. I think we've seen a failure of cooperation within the UN system to ameliorate that. And I think that we're at a situation where, for most people with NCDs in the poorest countries, their biggest issue isn't the disruption of NCD services, because there really are no NCD services to any great degree. It's lack of progress towards universal health coverage, which they faced over the past decade, and that they realize now that they've been on their own. And in an environment where economic growth rates are not going to be these kinds of imaginary 6% growth rates and everything's going to be solved by domestic financing in the next decade, where do we turn? There are other forms of transnational solidarity that are based around specific diseases, groupings of diseases. And I think that if we seriously want to make an impact on NCDs in these settings, we need to start taking these issues seriously, because they've been the greatest bottleneck to progress since the first high-level meeting. So maybe it's a little bit of a provocation. Back to you, Anushka.
So maybe I'll just ask a quick follow-up question there, Jean. So in relation to your comments about global solidarity and the crisis in funding, do you think the COVID-19 pandemic provides an opportunity for research and advocacy in this space to be accelerated or reformulated in a way that might assist?
Well, I think it should open our eyes that, you know, the way of doing business the past decade was not effective. And, you know, I think that in reality, probably in some ways not that much has changed, right? Like you know, we didn't have a global response that was adequate in the past decade from you know, the existing sort of bilateral and multilateral arrangements. And that hasn't changed fundamentally. And I think that our expectations for that system to you know, provide a solution, which it didn't provide under optimal circumstances now in the COVID situation, is not realistic. And so I think that we need to think about, you know, other ways. We need to expand the institutions, the individuals that are aware of this issue, that are committed to it, beyond sort of this world of you know, relying on hope from action at a bilateral or multilateral level within the United Nations system. I think that, you know, those things can certainly be, you know, extremely helpful, but they clearly haven't been sufficient, and I don't think that there's a reason to think that they're going to be sufficient.
Thanks very much, Jean. Katie, could I turn to you? You lead an organization which is really the leading advocacy voice in the space. What's your perspective?
Thanks, Anushka. Yes, in terms of the first question around kind of specific research priorities, I mean, as others have already highlighted, you can't really talk about COVID without talking about NCDs. We all know that, and there's such kind of strong connections and interlinkages. So for me, I think one of the main kind of, you know, research priorities is really kind of around multimorbidity, which was already, you know, a massive problem beforehand, you know, and the extent of the problem is absolutely vast. But, you know, for example, you know, one study shows that between 13 and 95% of patients globally are affected by multimorbidity, which just shows the kind of little understanding of the issue, that pure range of percentage between 13 and 95%. And obviously the COVID pandemic has really kind of shone a light on this because of this deadly combination of NCDs such as obesity and diabetes and cancer, you name it, and COVID. And as Jean said, you know, underlying medical conditions was this phrase used by politicians around the world in the early stages of COVID. And, you know, when you take that, you know, very vague phrase away, it's essentially the NCD agenda, which, as we all know, has been, as Jean just highlighted, has been hugely underinvested and under-prioritized over many, many years. But particularly in terms of the multimorbidity part of things on COVID and NCDs, I think one area which is obviously still very early stages in terms of the research and understanding is the long-term effects of COVID on people affected. You know, obviously we've got, you know, more and more evidence coming out about long COVID and, you know, long haulers as they're kind of calling themselves now, in terms of the debilitating symptoms that are continuing long after, as well as kind of long-term damage to, you know, to heart, to respiratory, to kidneys. So in a way, COVID it could be really fueling kind of a huge number of new people with NCDs around the world, together with the billions that we already have. So trying to understand kind of, you know, what's going on there in terms of the connections, as well as, you know, the implications from a health system perspective, from a financing perspective, and obviously most importantly understanding, you know, patient perspectives, people living with these conditions, and really trying to ensure that they are really engaged in and involved in the research and the responses, because I think we've seen very clearly in COVID that the way that governments responded to COVID was in a very, you know, fast, theoretically in a very fast and urgent way, at the expense of actually engaging patients and the public in many contexts. So really trying to reconnect and make sure that people are very much involved in the research and the response.
Great, thanks, Katie. I'd like to, before going on to our other panelists, go back to Benti. And Benti, you had some additional points that you were going to make around the government ask, so we'll get your slides up as well.
Yeah, thank you very much. Because so far I commented on my sort of optimism or pessimism, and I try to make the case that, you know, what we saw was that 163 ministers of health actually were able to define research questions themselves linked to NCD. So that is a very positive push, I think, for the research agenda. But I want to mention that it is really three areas that comes across as very important and prioritized as a building back better based on the COVID-19. And the first one is on the critical preparedness, readiness, and response. And Katie mentioned it already. So what we have done, we have been able to analyze and see, you know, the significant comorbidity with COVID-19 at national level. So we have several very nice studies, and they show, I mean, like 50% of the COVID-19 deaths is actually due to diabetes, also heart diseases, and so on. But we don't have the same figures at national level, and this is a very, very important question asked by many people. And the other one, we will come back to that later as well, I guess, but it is really the disruption of essential NCD services. And we need to know what is the excess deaths from NCD during COVID. I think this is really a good learning point, and I mean, sort of a horrible learning point, of course, and also how much of this is really resulting from disruption of NCD services. And I think on the basis of this, we will be able not only to improve the readiness and response during a crisis, but we actually need this data also to be able to shape and to be able to really see what kind of NCD services should be part of an essential universal health coverage benefit package. Then, of course, we have seen that the number of countries that have included NCD into the national response plans is very low. One explanation for this is that very late, like May, June, we have also in the operational guidance for the response and preparedness plans that they have to include essential services. So what we call Pillar 9 came very late. But we need to also have research linked to what kind of elements are efficient when we streamline this response. The second big area is the humanitarian operations, camp and refugees. And even if we have an NCD health kit to support treatment in these very fragile settings, we need to know more about the effectiveness. We need to know more how to really disseminate this, because this is very much focused on the emerald countries, for example. Many countries were asking for evidence-based guidelines for the management of NCD in low resource settings. So even if we have the pen packages and these things in peacetime, we don't really have the same amount of knowledge on how to utilize and also how to probably add to the humanitarian operations. And the small-scale NCD programs for refugee, including training and so on, we need to improve the coordination and collaboration between humanitarian agencies, academia, and governments. And I would say that this is calling on research on very many levels. It is actually a big divide. And we were talking about funding. If you look at the funding streams, they are not really interlinked. I can see that this is happening to some extent now during COVID, but this is also an area for research. The last prioritized area is, of course, the core business, which we saw so much in the surveys, and I added the surveys on the chat for those who haven't seen it before. But it's really to maintain essential health services. And someone mentioned on the video that when we analyzed what the mitigation strategies for countries were, we could see that across the board, regardless of socioeconomic status, it was actually to use telemedicine and digital platforms. When we look into this area, we have a lot of knowledge, but it's not structured in a way that we can really see that we can guide and also maybe utilize this for data collection and so on. And also, of course, to avoid what somebody was also mentioning in the film, that we have to be very, very aware of equity, both on gender and all kind of equity considerations when we start to use this. The two last thing on the essential health systems is, of course, the NCD risk reduction. and how to strengthen communication, as I mentioned before, and also how to ensure financing for essential health services for NCD. And I think there is no hidden message in this. We really need to focus on the UHC for NCD. And I'm sure many of you saw that a Lancet publication coming out last weekend showing that NCD is the one lagging behind. So sorry for being a bit lengthy, but I thought maybe this is sort of more the summarized our sort of priority areas that adds to and also reflect on what the Ministries of Health really asked us for through the surveys. Thank you.
That's fantastic to get that perspective from the government Ministries of Health. Thank you, Bente. I'll turn to Olive now. Olive, you have a strong focus on injury prevention and management, so very keen to hear your thoughts.
Thank you very much. Yeah, so I'd like to turn our thoughts to something that is might not sound to be central to NCDs, but it actually is, and that is active mobility. And I think, you know, walking and cycling have been given a big boost during this pandemic because in many countries there were lockdowns, and so this was pretty much the only mode of transport that most people could use. So for instance, in Uganda, where the lockdowns meant that all motorized transport was grounded except for essential services, for the first time probably in decades, people were then able to walk and cycle in safety and to breathe clean air. And so that was wonderful as it is, but there's a limit to how far people can walk or cycle if they are unwell or pregnant or in labor, and that's another different discussion. But now with the lifting of the lockdowns, we are very rapidly back to where we don't have any space to walk or cycle. And so those that can afford it have rapidly then gone back into their private cars, and the huge majority who can't afford a private car are then literally caught between a rock and a hard place. So they risk being killed or injured on the road as pedestrians and cyclists, or they then have to go to very crowded public transportation and risk contracting the virus. And so this then, I think, brings us the important nexus between transport and health. And I think that the struggle that many countries are going through right now as they attempt to lift the lockdowns have to do with mobility. And I think that this is where we could focus research to answer questions such as, what is safe public transportation? And countries like Uganda, you know, low and middle income countries where, you know, almost without exception have crowded public transportation, how can they maintain or even increase the numbers of people that are cycling and walking even after they lift the lockdowns and as they resume full economic activity while not increasing transmission of the virus? And I think there's some kind of contradiction there. Is it even possible? And I think the other question we need to address is, what contribution does public transportation have towards COVID-19 transmission in different settings? Because I think there's now a fear almost everywhere that public transport, commuter transport, is bad news, it's a threat, it's the one that's fueling COVID transmission. And yet there are many instances where people don't have other options, and so there's that fear. And I think we need to have to be able to answer these questions and to come up with the right policies that would then would direct where we go with transportation and with combating the virus. The other point that I think has to do with, and this is somewhat removed, is to do with the kinds of effects that measures to reduce transmission have brought to people living with disability. So if you take, for instance, the deaf and those that have hearing impairment, ordinarily, many of them rely on lip reading, and they've been closed out by the masks. If you think about those that are blind or that have visual impairment, ordinarily they would feel their way around, or they would read with their hands, they would find directions. And currently they're told, don't touch anything. and they terrified themselves about contracting the virus because of their hands. And so I think that we need to quickly understand these challenges and find ways around these barriers so that these populations that were already marginalized to an extent are not continuing to be disadvantaged. And I think that the last point that I'll make here is about food. And I think one is probably going to talk about this, but the idea that the lockdowns were almost guaranteed to create a huge, masses of people that were malnourished, acutely and going forward. And what those connections are between acute, ongoing malnutrition and future NCDs in these populations. And I think that there's an area there that we need to research. But maybe quickly to go to whether I'm optimistic. So I think there's reason for optimism because indeed the pandemic, somebody said in the film, awful as it has been, it's an opportunity. And I think it's brought something that the world was neglecting, and it's all got our attention. I'm concerned though that there's the many governments that think, for instance, that it's not possible to have safe roads, clean air, active mobility, and economic development. And they think, no, we must sacrifice something in order to attain economic development. And I think we need to bring in the evidence so that we can show that with the right policies, we can have safe roads, active mobility, clean air, reduce NCDs, and have economic development. I think the other areas, violence and mental health, have been mentioned already.
Great, thanks very much, all of those comments. And your comments on nutrition, I think, are a great segue to Juan Rivera. Juan, we know you work a lot in the nutrition space, and Olive referred to undernutrition, but there's the full spectrum of nutrition that's been affected by the pandemic, and very keen to hear your thoughts.
Thank you, Anushka, for inviting me to this very, very nice panel. So I think I will start by a big question, an overall question that has to do with our current economic model, which is creating a syndemic of obesity and non-communicable diseases and undernutrition and global warming, and now is really making the life of people with COVID more difficult, so increasing the mortality and the severe cases. And Boyd Swinburne has coined this syndemic term. Now, our food systems are currently feeding 7.7 billion people, but have failed to end undernutrition, hunger, and extreme poverty, have created an obesity and non-communicable disease pandemic. And how can we transform our food system into one that is healthy, that produces healthy food with minimal processing, sustainable, that produces in a way that reduces the degradation of our planet, and is also fair, contributes to equity, and how this system can be built. And also our economy that sustains also the life of all these many people in the world. How can we transform that economy so that at the same time it contributes to health? And I think that this is an essential part of the preparedness we need when we go, building back better is really having a preparedness strategy for the next pandemic. But I think that without having a reduction in obesity and chronic diseases, we will always have huge effects of pandemics on fatality rates and so on. The second big question, the question that I will ask is much more a clinical question and has to do with, that fatality rates from COVID in young people are much higher, for example, in Mexico and other countries, which have high prevalences of non-communicable diseases, particularly diabetes and cardiovascular diseases. And we have published an article showing that in Mexico, fatality rates are much higher in obese patients. Barry Popkins have just published a meta-analysis of 75 papers produced during this period, showing precisely that in all the world. Now, the potential mechanistic pathways for factors linked with COVID risk and severity in obese patients suggest that therapeutic and prophylactic treatments may be less effective in these patients, people with obesity and non-communicable diseases. And I think that that's a whole area for research, because can you imagine, even if we have a vaccine, but it's less effective on these patients? So I think that there is a need of a lot of research, that is clinical research. And then finally, I would like to propose also that the higher risk of complications and mortality for COVID have highlighted among public health experts, leaders, and the public the need to take actions for the prevention and control of obesity and non-communicable diseases. So this is an opportunity for the design and implementation of a comprehensive packages for obesity and non-communicable disease prevention policies. And that's happening already in Mexico. The public is now demanding more intervention from the part of the state, because they know that these conditions aggravate COVID. Great Britain has also started some new policies. Now, for these policies, we need sound research so that the policies are based on science, and then we have to evaluate those policies. So I see that this period has also increased the opportunity of the applied research on the design, implementation, and evaluation of interventions to tackle obesity. And finally, regarding optimism or not, in the first phase, I was very pessimistic. I was concerned. It seemed that research was focused only on vaccines, diagnosis, treatment for coronavirus. NCDs were not present in the conversation. However, given the importance of NCDs as risk factors for severity and mortality, I think that now there is a renowned interest in these topics, and I'm optimistic in terms of thinking that we will have now the opportunity to do more research in these areas, that funding agencies are now paying much more attention to these conditions.
Thanks very much, Juan, for those comments. And you, as well as others in the video, we've seen a number of questions around research needing to have a strong equity lens, and increasingly so in the context of COVID-19. Rajni, can I turn to you? And I know you have interests that your work intersects a lot with community engagement, scale up, where equity is a very strong consideration. What are your thoughts?
So thanks, Anushka. I'd just like to address the issue of whether I'm optimistic about more funding. And strangely enough, I am actually, because at the societal level and at the governmental level, there has been this great awareness that people who had NCDs or some of the risk factors were actually much more vulnerable to COVID. And so even during the COVID response, of course, later on, not early in the phase of the pandemic, you could see that there were special targeted efforts being made to reach people with NCDs. Not enough, perhaps, but certainly a good beginning. So in a sense, I am optimistic that the NCD research will actually step up, because as one of the speakers said, that other pandemics in the future will also have to contend with this, that people with NCDs are really much more vulnerable. The second point about, and I'll come to the community engagement piece in a moment, I think the area for prioritization of research is how did health systems adapt to COVID? And I think that's really critical, because the biomedical and the social research will provide us with some understanding of what are the issues, but how do you convert this into operational strategies to allow countries to mount responses within their systems that can enable a pandemic-like response? And certainly, I think the response to COVID has thrown up several innovations, things like telehealth, telemedicine, self-care, home care. All of these things were not things that we usually talked about, but I still think they require and deserve a lot of research, particularly from the equity point of view, because telehealth and telemedicine, certainly in internet dark areas, are not accessible to people. Self-care and home care are really, they're not easy for people to learn. And people with, again and again, and I come back to information asymmetry, people's capabilities to be able to absorb this kind of, the skills with which you need skills for self-care. And therefore advocating self-care and home care at scale could be a little bit problematic, particularly when you're looking at the marginalized and the vulnerable. And I think in the equity lens, certainly for COVID, we need to look at it from the point of view of geography. The equity, the NCD and the COVID intersection, geography, gender, class, these are all very, very important to look at when we are supporting research. And I have another point that I'd like to make, is that we need to do much more research into the behavioral factors that underlie responses to NCD by individuals, by health systems, and by communities. And therefore, I think certainly obesity became a much talked about issue. It wasn't talked about very much before the pandemic, but now you can hear across classes of people, obesity has become an area of concern. And I hope that we are able to build on this and demonstrate health systems responses. One final area for research is looking at workload allocation among health systems workers. One presumes that health systems are infinite and elastic, and they're not. And we heap so much work upon our frontline workers, quite forgetting that they already had workloads, that they're the first set of people who had to deal with stigma and discrimination in the community. They were the ones who went out and were vulnerable because some of them didn't have the personal protective equipment that was needed. So looking at service providers and doing research into the needs of service providers is equally important when we're talking about any research into the pandemic. Thank you.
Great, thank you very much. Those are all fantastic comments. We've already had a number of questions, and I'll come to those very shortly. Some of them expand on the areas of discussion and some are new areas. But what I'd like to do now is, if we could have the results of the poll up, I think we can say that the panel is probably more optimistic than the audience by the looks of it. So we have a few more people who are half glass empty, but I think there's enough voting for each category that this leads to very, very, very healthy discussion. I think many of us probably share the views that were expressed that earlier on in the pandemic, a lot of us were very pessimistic, but perhaps more optimistic now. So we'll put up the second poll as we move into the second part of the discussion. So Anna, if you can put up the next question. So this question is, what are the most pressing issues? What is the most pressing issue for the global NCD research agenda if we are to build back better after COVID-19? Now, clearly there can be many more responses to the three that we've offered here. But the three we have offered are reducing inequities, breaking down health silos, and developing meaningful community engagement. So please, at any time, vote on that poll. So I'd like to now move on to some questions, and we've had quite a number from the audience, and I think a couple of them do actually reflect an issue that we've already touched on, which relates to somewhat to multimorbidity, but also just breaking down health silos. And I think the COVID-19 pandemic has highlighted the pressing need to move away from parallel disease responses. So what evidence do panel members feel we need to generate to help make that shift towards perhaps more of an integrated, people-centered approach to whether it be prevention or management? And maybe I'll in the first instance direct this question to Katie, but others please feel free to pitch in.
Sorry, thanks Anushka. So in terms of kind of breaking down health silos, I mean, I think one thing that COVID has really kind of exposed in a really interesting way, which Bente touched upon earlier, is this whole connection between NCDs and pandemic preparedness. I mean, until COVID, no one was talking about, you know, the risk factors of NCDs and NCDs in countries as potentially an important factor to be considering in terms of how you know, countries are going to be doing in response to COVID and how populations will be dealing with the virus. Even though there are, you know, there's evidence to suggest that, you know, NCDs were a predictor of severity of disease around SARS and MERS as well. So there is kind of, you know, examples and evidence from other viruses where this has happened. But you know, I think with COVID, where there's a, you know, in terms of the optimism versus the kind of pessimistic view of where we are, I think there is a real opportunity for actually, you know, building and prioritizing NCDs into health security agendas, for example. And you know, there's huge political capital and interest in that issue right now, obviously quite rightly, and we hope it continues. But you know, really trying to, you know, we've looked at, for example, you know, health security index, for example, of how countries are actually ranked in terms of how well prepared they are for viruses like COVID, and you know, NCDs and the kind of resilience of populations around the prevalence of NCDs is just completely and utterly absent right now. So I think this pandemic provides us with an opportunity to integrate NCDs into those agendas and building upon one of the questions that has been asked by one of the audience members about funding. I mean, that's an opportunity from a funding perspective, because you've got some governments where, you know, health security, human security is a major priority and NCDs is not. So if we're able to kind of integrate those kind of pieces, I think that could be really, really valuable. In terms of kind of integration within health systems, I mean, I think it's pretty clear, you know, around the world that there are many different models and ways of integrating NCDs into service delivery platforms. And I think what's needed from an evidence perspective is to understand better about kind of implementation science, basically, implementation research of actually, you know, what's working in different contexts. Health systems are different by country, by region. And so how we're integrating NCDs and providing kind of people-centered care will really vary by country and region. But really trying to understand what's the enabling environment for integration, because it doesn't just happen in a vacuum. There are important political dynamics around integration, as well as obviously the more technical side of things in terms of health systems that we need to be thinking about. So really trying to understand it in terms of the enabling environment and understanding, you know, success countries where we've got trailblazer countries of where we've seen really effective integration and people-centered care, really trying to kind of highlight them and disseminate the good practice to other regions.
Thanks, Katie. Anyone else like to comment on that sort of breaking down the health silos and the opportunities we have at this moment? I think the example around health security is a fantastic one. Juan, maybe yes. I'll go to you first.
Oh, well, I just wanted, I mean, Katie did a very good job on talking about this, but I just wanted to talk about the health systems in places, you know, countries like Mexico and Latin America. And I think that part of the problem, and, you know, the way to break down the health silos is to strengthen our primary health care. You know, in our countries, primary health care is almost absent. It's amazing. It's in the hands of the private sector. And the best way to break down is really through strengthening primary health care, because that's the way to have a people-based approach in healthcare, and to provide also public health services. And by public health services, I'm talking about the promotion and prevention of health and surveillance systems, and then also policies that create enabling environments. So through strengthening primary health care, and of course the link between primary, secondary, and tertiary care, that's a very good way to start breaking health silos. Thank you.
Thanks, Juan. Maybe I'll move on to another question, and Benti's already put up her hand to answer this, which is good. So the question is, isn't part of the problem that most of the response proposed by the WHO and advocated by organizations such as the NCD Alliance is prevention rather than care management, health systems, and access to medicines? So a provocative question for perhaps both Benti and Katie.
So I think it's very important to not sort of call for a competition between prevention and management. So I think WHO and the member states of WHO really did a fantastic job when they first sort of approved the global action plan and emphasized on prevention, which was almost completely lacking from sort of the attention of the decision makers. And we also know that if we really, you know, stop smoking, curb alcohol and physical activity increase and all this, and of course healthy nutrition, we know that this is sort of impacting to 2/3 of the impact to be able to achieve the 2030 target. But I must say that, you know, it was really an eye-opener, at least for me, to see how sort of COVID disclosed the conditions for people living with NCDs. So I think when we now move towards the new high-level meeting in 2025, and we also have an evaluation of the global action plan, we need to sort of also be able to address the NCD agenda a little bit different. So I think, first of all, we have to look through the whole life course. We have to focus before the birth of a person. You know, we have to look at all the settings, all the possibilities to influence people's life in a positive way. And we have to really focus on people living with NCD. And that's actually why I am now a director for the NCD department, because Dr. Tedros has a huge interest in those having hypertension, those living with diabetes. And everybody around this table and all the listeners, I'm sure they know that, you know, you cannot treat a person with diabetes the same way as a person with cancer. So I think this is exactly what we see, and I completely concur with my fellow panelists. I think what we need to do is to focus on primary health care. We have to really utilize the experience from COVID now to focus on the essential health services that every country should give access to, regardless of socioeconomic status and gender and what have you. It's very, very important. So I think also Katie's point is that we will never get there actually unless we do the same as we did for HIV/AIDS. We need to bring the people both living with and also concerned and affected by NCD to the table, to the decision table. We need to have co-creation of the solutions. And I think this is a very intriguing and interesting task to do. So that's why I have started to use the hashtag Next Generation NCD, because we have to sort of allow ourselves to really utilize the experience and also all the experiences from people living with NCD. And I just want to also agree totally with those Olive, others on the panel, because I think we cannot avoid, you know, really being multi-sectoral. So we were talking about mobility, we were talking about food systems, but don't let us sort of get drowned in all this. We have to sort of also be able to put a spotlight on, without being accused for working in silos, because I think to put the spotlight on diabetes or tobacco for that sake, or mobility, it will lead us into the same structure if we are able to sort of keep the oversight and the understanding that it's really the systems that has to change, and also the domestic funding will have to be there in addition to international funding. So I can come back later on, but we have tried to formulate this in 8 sort of very sort of important actions, which try to sort of avoid this discussion, either prevention or management, either sort of silo or integration. I don't think that is actually helping us. Thank you.
Thank you for that, Bente. I think another question from the audience that partly relates to this, not so much silos from a health perspective, but an understanding. I think, Olive, this relates a lot to the points you were making, that from a researcher perspective, we perhaps need to be more focused on working in an interdisciplinary fashion and use the examples of active transport, but there are many others. And I wonder whether you want to comment on how might we better operationalize and attract funding for more inter or transdisciplinary research?
Thank you. So this is the perfect example of where one needs different sectors, different disciplines to come together and address a problem. And the problem can continue to expand, or it can sound to be overwhelming. But I think if the various sectors agree on specific targets, most of which targets are already set either as part of the Sustainable Development Goals or various other programs and targets, then those sectors can actually agree on what each sector is going to contribute and what their targets should be. So for instance, in terms of reducing road traffic crashes, which can sound very narrow until we realize that we are involving engineering, planning, and education and policing and so many other sectors. And yet each of these sectors can define what their exact target should be, and so what their contribution to the solution should be. So I think that rather than feel overwhelmed and think it can't be done, I think that what the pandemic has showed as well is that no one sector has all the solutions. We all have something to contribute to the solution.
And maybe a follow-up question to that, and to Olive or to anyone else on the panel: Have we done enough to co-opt champions for NCD prevention amongst non-health professionals? And I think this might also bring in the planetary health and the One Health agenda. So from the environmental sector, economists, urban planners, etc. Have we done enough, and has COVID-19 provided a real impetus for us to do this better? Would anyone like to comment on that?
I think at least if Kate is not saying anything, I think the next week will at least be a golden opportunity again, to really make a stake for NCD, since NCD Alliance is really dedicating the full week of action for NCD. I think this is a continuous advocacy and also educational question. I mean, I clearly remember when I worked with the IFPMS, MSA, the Medical Students Organization, and we did the poll, how much do the universities really teach the students about the NCDs, and especially NCDs and public health. That was a really depressing moment, I would say. So I think we just have to realize that this is a continuous effort, and thanks to Katie and NCD Alliance for doing this next week.
I'm happy to. Thanks to Bente and WHO for doing my pitch. That's great. So yeah, and to answer the question, I mean, I think there's an awful lot more we need to be doing to engage non-health communities, and I think COVID again is kind of a really good opportunity to actually be accelerating those efforts, because I think, as Juan was mentioning earlier, I mean, the world is kind of reassessing so many different things right now in terms of economic models, in terms of how we're designing cities to promote active transport, as Olive was saying, how we're working, virtual working from home, what that means from a health perspective. And so there's so many opportunities for the health community to be doing interdisciplinary research right now, to be ensuring that the health considerations are actually well reflected in how we are building back better, and kind of hopefully coming out of this in a more positive front. And as Bente said, next week is our global week for action on NCDs, and to kind of pivot to one of the other questions that has been raised, I mean, the theme of next week is all about accountability. So it's about, the fact that, as Jean mentioned earlier, there's been so many commitments over the last 10 years on NCDs, but we're still in a situation where, progress at the national level has been really patchy and, really uneven. And it's not just in low middle income countries, it's very much high income countries, with some high income countries actually going backwards rather than forwards. So the theme is on accountability, and it's looking at both, accountability of governments, but also of industry. And there's obviously a huge amount of discussion around the commercial determinants and unhealthy commodity industries' role in all of this. But to answer one of the questions, which I think is around kind of corporate influence in setting policy agendas, Not to give too much away of next week, but we're coming out with a new report, which is actually the result of crowdsourcing of our network of examples of where the unhealthy commodity industries such as big tobacco, big alcohol, big food, big soda have really tried to co-opt the COVID agenda. And the report will cover areas such as, their CSR activities, their marketing and advertising activities, as well as influencing policy, as well as interesting partnerships that they're creating with different entities and governments and civil society alike. So I think it's very clear from this report that will be launched next week on the 10th that industry have very much seen COVID as an opportunity, and it's going to be damaging from an NCD perspective because these are industries that are promoting products that are unhealthy more than anything else. And in terms of how they're actually influencing policy, it's things like trying to get their essential products such as alcohol, tobacco as kind of essential during lockdown in countries. It's pressure to accelerate the emergence from lockdowns due to kind of business interests and their bottom line, as well as obviously being very much in the pocket at sometimes with governments in terms of shaping policy responses and recovery strategies to COVID. So just wanted to kind of flag that this report's coming out, and we received over 700 case studies from our network that really are the center of this report, and fascinating and stuff that will come out in terms of what we need to be doing to respond to this.
Great, Katie. We really look forward to that next week. And I think I'll go to Juan in a second. But I think, well, maybe Juan, why don't you go ahead now?
Yeah, just very brief. Just on this topic, some promising news from Mexico. For the first time in Mexico, we have a government body in which there are many sectors presented: agriculture, environment, education, health, and economy. And the aim is to produce a health system that is, a food system that is healthy, that is sustainable, that is fair. And, it's interesting because the beginning of this group was trying to prevent obesity and non-communicable diseases. And we came up with this group that is official now and is really working very, very well. So that I just wanted to make an optimistic mention of something that is going on that is nice.
Thanks for that, Juan. That's great. I think the influence of industry in this period is going to be yet another factor that's increasing the inequities that we're seeing are widening everywhere across the economic spectrum. That's just been exacerbated by the COVID-19 pandemic. I'd like to bring in Jean and Rajni on this next question that relates to, we've touched on this a little bit, but what kind of evidence do you think we need to inform policy responses that really focus on the equity issues that are really becoming quite substantive now?
Anushka, would you like me to start? Yeah.
Yes, please do, Jean.
Well, I think that, one of, we face this everywhere in health, but I think that in the NCD space, there's such a huge heterogeneity in some of the major issues that are important from an equity standpoint, right? And by equity, I think we often sort of mean priority to the people that are worst off. And if you look at NCDs, there's just a huge heterogeneity between somebody with hypertension versus a kid with cancer growing out of their face. Those are very, very different from an equity standpoint, and so there's a real need for disaggregating our response and giving some priority to more severe conditions, basically, and conditions that affect children. And we're really, in terms of our metrics and the way that we talk about NCDs, we're very much driven by prevalence, and we don't take into consideration that very crucial aspect of equity that has to do with severity at an individual level. And I think that the COVID should really highlight that, because there's a real danger in kind of lumping the kind of risks that somebody with hypertension faces in this, and the kind of risks that a child with pediatric cancer that's born with congenital hydrocephalus or that has sickle cell faces. And this might be a transformative moment in that way, in terms of taking that into account. The other aspect of equity that I think that we, cross-health have an issue with is sort of this question about poverty and disaggregation by socioeconomic status. And I think that there is there's a reality that probably most of the people that are currently on treatment for NCDs are not the poorest people. Because health services, public health services have not been established largely in the poorest countries for the poorest people for NCDs. And so if we have a response that's narrowly focused on maintaining existing services, that's obviously very important, but it misses this equity dimension. And I think that it might raise the priority of having equity, socioeconomic status linked to treatment registries, like, for example, to promote something that's coming up, but we're launching the report of the Lancet Commission on Reframing NCDs in Interest for the Poorest Billion that Katie and others were part of as well. It's being published on the 14th of September and being launched virtually on the 15th. You see that, like, cancer registries, we know very little about people who are on treatment for cancer. Are we reaching the poorest with cancer in Uganda? We don't know in our cancer registries what the socioeconomic profile is of people that are receiving care currently. Do we know who with type 1 diabetes is currently, what is their socioeconomic profile? And so I think in terms of accountability on progress towards universal health coverage with NCDs, this aspect of disaggregation becomes really important. And we've seen this, the importance of this with social protection. We want to protect people from the socioeconomic effects of what's happening in the face of COVID. And there's lots of reasons to think that the folks with NCDs may be particularly vulnerable, because there's no international community really that's committed to their protection in the way that there is for HIV or other conditions. There's really no community with resources that's organized to protect those people. But at the same time, we know so little about what the socioeconomic profile is of people that are currently identified. So those are just some of the issues that I would highlight: disaggregation by severity and disaggregation by socioeconomic status. So back to you, Anushka.
Thanks very much, Jean. Rajni, I mean, you have a critical role in government, what sort of research do policymakers in this area really want to see right now?
So I think Jean's already talked about metrics. There's one particular metric that I think we really need to strengthen, which is death reporting. Standardization and strengthening of mortality surveillance is critical, and COVID is continuing to show us that we are not perhaps counting the deaths as well as we should. And that is a particular issue of inequity, because we don't really know who is dying where. And so I think that's a very important, certainly for LMICs. The second area that I think evidence is needed is largely to do with implementation research, on particularly looking at who are those who are we are missing out at primary and secondary care levels. And we're missing them out because we don't have a decent screening program for non-communicable diseases, and we don't have enough access to medicines. We've seen that wherever there have been efforts at strengthening the primary healthcare system by integrating, by being able to provide free medicines to the poor, the number of footfalls in government health facilities has increased dramatically. So clearly there's a huge need out there. And again, it affects the poor. So in terms of equity, the evidence that you need and to convince policymakers is that access to medicines is a very important government health function, and the state cannot move away from it. I think the second major area, and this pertains to all of health, is how important are investments to health. And I think constantly providing evidence to this government that unless you invest in public health systems and in ensuring that you have an integrated health system, and I think that's where COVID, I really see, if there's one silver lining, and there must be a few, but certainly is this one, that COVID offers us an opportunity to, otherwise most communicable disease programs are very vertical programs. And that's been the problem that we've had with selective primary health care, vertical health programs. But now COVID has brought, because it's brought NCD and the COVID linkage into focus, allows us the opportunity to integrate. But we need evidence to show to policymakers and programmers, program developers, how they can actually design strategies in which you integrate both the COVID response or other communicable disease response with non-communicable disease action. Because health systems, as I said before, are finite. They just cannot absorb just adding on more without making sure that you have adaptive strategies that address these complex issues. And for poor countries, looking at primary prevention is really very, very important. Secondary prevention has its place, and social protection policies must take secondary prevention into consideration, treatment, access to dialysis, etc. But primary prevention is critical, and that's where all of the points that people talked about. I think with multi-sectoral convergence, sometimes it's easy to say, but how do you operationalize it within a large-scale health system? I think these are challenges that countries like ours still face. And so you do need evidence to show how this would work.
Great, thank you very much. Look, I think we're coming close to the end of the session, but there is an opportunity, I think, to just go around once quickly and make any final comments, anything you think you hasn't been covered or you'd like to add. Maybe we'll start, Rajni, again with you. Any final comments that you'd like to make?
Yes, that both researchers and funders need to keep in mind that whatever research they embark on, whether it's biomedical research, sociocultural, it needs to have a feasibility trial to be able to make sure it can be scaled up into large-scale systems. We just can't afford blunt research anymore. I think sometimes there is that danger, and policymakers react quite negatively to that kind of research. And I know there's a little bit of an exaggeration on that side, but I think we really have to be very focused if we want policymakers to take action on the kind of research we are providing. So.
Thanks very much, Rajni. Jean?
No, I think it's been a great discussion. I think again, I think that something that might it's not so much necessarily a time for navel gazing, but I think that it could be a moment for the NCD community to ask itself whether it's an opportunity to pivot from the kind of research and the kind of framing that we've had the past decade, and what does COVID mean for it. I think that in sort of hearing our discussion, I think that we're kind of in between a paradigm that kind of narrowly defines NCDs as a set of issues that are really about cardiovascular disease, in older people, that comes out of a European sort of model of cardiovascular risk, Framingham and North Karelia, et cetera, being generalized to speak for all the NCD issues. And I think there's a temptation with COVID that because there has been that intersection, in high-income countries, it's very clear to kind of maintain that paradigm. At the same time, there's a lot that we're seeing even here, in terms of discussion of injuries from Rajni that have been, really, there hasn't really been much space for in global health policy, and kind of the broader range of issues that we use to talk about when we talk about NCDs, and sort of being caught between those two, and still not knowing, what really the agenda is. When we're talking about a research agenda for NCDs, is it a coherent category, to be proposing a research agenda based on, and is it a time to kind of pivot towards more specific subsets so that we're actually making progress, in each of these issues? Does it really make sense to group many of these things together in the way that we have been? And I think that that's sort of a challenge, I think, for research. Like, does it make sense to have an quote NCD research agenda given the heterogeneity of the issue properties, the severity, geographies, et cetera? So over to you, Anushka.
That's great. Thanks very much, Jean. Katie.
Thanks. Yeah, I guess I'll just pick up on a point that was raised by a couple of people earlier, which is about kind of community engagement and ensuring that voices of communities, people living with, are kind of at the centre of the research response around NCDs in COVID. And I think, as I mentioned earlier, at the beginning of the emergency phase, it was very clear that it was kind of being seen as a non-essential. It was a kind of nice to have. And, I think we all know that, the expertise, the resources, the skills of people and communities are still not well recognised by governments and global organisations, and are not systematically used to really improve care and outcomes. So, my comment is just to make sure that, within research initiatives, that we're engaging patients, people affected, their carers, whether it's across clinical trials, whether it's in expert committees, whether it's in WHO's ACT Accelerator across the 4 pillars, whether it's in terms of ensuring people are helping co-design health systems and delivery, just making sure from the beginning that those views and perspectives are incorporated rather than at the end, which is probably the norm rather than the exception.
Absolutely. Thanks, Katie. Very important point. Olive.
Thank you. So I think I'd want to echo something that Jean talked about, and that's accountability. And I think that many countries, certainly in my part of the world, at the beginning of the pandemic, were completely overwhelmed with not the cases, but just the threat that was coming at us, and we didn't know how we were going to fare. And I think, and then there's been, an outpouring of funds and resources, and I think that we could very easily squander all of these opportunities because of lack of accountability. And we've seen it before with other things, certainly not at the magnitude of a pandemic, but I think that good things happen with preparation. And if countries are not prepared, if they do not have the systems to be accountable, then it doesn't matter how much resource they get, whether it's in research or in implementing programs, there's going to be a problem. And then just to pick up very quickly on what Rajani said with, for instance, the fact that we don't quite document deaths properly. So if we would say, for instance, that every day the Ministry of Health reports on how many people have died or how many people have tested positive for C19. And since the pandemic started, so 30 people have died of COVID-19 in Uganda. And in that same period of time, we have lost about 2,100 women out of pregnancy-related conditions. We've lost about 36,000 children below the age of 5 for various conditions. And so it tells us that unless we take advantage of this opportunity and cut down on those silos and look at a health system that addresses all of our concerns, that picks up on those populations that are vulnerable, no matter the threat, then countries could very easily just ride on this wave, and when it's gone, they ride on the next one, and we don't really advance health in totality. And so I guess for me, that would be, do we have a research agenda? And it's not quite what the agenda is, but even whether that's what we need and how we go about it. And so I think those are the challenges that are facing governments right now.
Great. Thanks very much, Olive. And Juan, if you have some brief final comments.
No, just a very general comment that I really like the title of the panel, Building Back Better, because I think that as awful as the pandemic has been, the worst sanitary crisis in a century, it also brings us the opportunity to strengthen our health system, particularly the public health services and the primary health care that are so weak in many, many countries. And at the same time, to reshape our food system and our economy. And really, the idea is to place the health and the well-being of people at the center of all policies.
Great, thank you very much, Juan. And Bente, final comment from you.
I am very happy that so many of the speakers are talking about implementation research. This is something we really try to leverage. We have a small program, and there are very few funders really interested. So I think if we could make a case for this, it would be great. But then I think data, and it was mentioned by several, as long as we don't really have registration of comorbidities or death mortality data available for policymakers, it's very, very difficult. Of course, I mean, that cannot take away the real fact that NCD is the biggest killer and 15 million people died prematurely, and it is really the low-income countries that are affected by that epidemic, let's call it that. So I think we are at a critical junction, and I don't think we cannot avoid acting now, and I hope that is sort of the sense people have from listening to us today, that if we make this moment just go away as if nothing, we have really not done our job, in my view. So building back better, building the next generation NCD on the basis of what we know, and bring the people with NCD to the table. I think this is really, really important. And I must say that, you know, for me, it is not about the name of the diseases. I think the most important thing is to really use the moment to define the essential health services that are needed for these people, and bring it into primary healthcare, bring it into UHC. So thank you very much again. A pleasure being here.
Fantastic way to finish. We will just very, very quickly, if we can, Anna, just show the results of that final poll. So inequity is very important, but I think all three areas have been recognized as being important. So on that note, really a huge thanks to all the speakers, Rajni, Juan, Bente, Olive, Katie, and Jean. Thank you very much for your time. Thank you to all the participants who've joined at all hours of the day and night all around the world. Just quickly like to mention that this event is part of a wider initiative by the George Institute to highlight the impact of COVID-19 on NCD prevention and management, and some key research questions emerging. Some of you might have seen the findings from an initial activity that looked at an analysis of clinical trials of COVID-19 and how they relate to NCDs. But you can see on the screen now there's a web page that will illustrate some of these findings. So please feel free to visit this page. We'll be compiling the results of the polls in a selection of your tweets and showing these on the website. So please look for these in the coming days. So again, thank you again to all our panelists. Thank you to all our participants. We really look forward to continuing the conversation. But for now, lots of us need to either start our day or go to bed. So thank you very much, and goodbye, and see you all again soon. Thank you.